Most of us want whiter teeth, but getting them is not easy and is certainly not cheap.
Still ahead on Your Morning, we'll show you all the options for getting a whiter smile. Which one works the best? Which ones are the most expensive? And which ones are a waste of money? That's next when we come back right here on Your Morning on CN8. You know, the last time you smiled in the mirror, were you unhappy with the set of teeth smiling back at you? If so, you're probably not alone. Millions of people are bringing back that pearly white grin with teeth whitening. But is it safe, and is it really for you? Joining us this morning with the inside scoop on teeth whitening is Dr. Melvin Pierson. Nice to see you.
Nice to be here, Connie.
Well, I guess the first question is, are all stains created equal?
No, they're not. You really have two categories of stains. You have stains that are yellow and brownish in color, and you have stains that are grayish in color. The yellow and brownish stains are due to age, smoking, coffee drinking, tea drinking, and those stains are easier removed than the stains that are gray in color, which are caused by tetracycline.
Tetracycline would be an antibiotic.
It's an antibiotic used a lot in the 60s, and we're seeing that a lot now with some of the baby boomers. They want to come in and get the teeth whitening.
Yeah, so not impossible, but still not the easiest.
Not impossible. They will be whiter than they were when you started, but it won't be as dramatic as a yellow or brown stain.
Okay, so about 90% of people then really find success with teeth whitening. About 10% don't. What do you do then for those 10%?
Well, the 10% of the people are usually the people are not categorized. Usually to be a good candidate for teeth whitening, you have to be categorized, such as getting your teeth cleaned professionally within 3 months, cavity-free, gums free from periodontal disease. A lot of these individuals that are in that 10% are going out and doing over-the-counter, undentist supervised procedures, and that's where they're getting into the problem.
Okay, so to start with, you have to have your teeth in good repair.
Correct.
Okay. Now let's talk about some of those different types of systems that are out there, because as you said, you can do things over the counter,
yes,
and you can do things kind of high end.
Yes.
Let's start with the laser treatments that a lot of people see the light. Tell me about that.
Yes, this is a demonstration of one right here. This is the high intensity light system, and this system is done in office. It's very effective, very rapid. You get teeth whitening within about an hour, several shades. It's costly. It's going to cost about $600 and up.
No, it takes about an hour, you said?
About 1 hour to do.
Okay. And how long will that last?
It really depends upon the patient's age, their habits, their smoking, their drinking habits, but usually it'll last from 1 to 5 years, depending on the patient.
Okay. And when you have your teeth brightened and whitened, is it taking all of the stains out and leaving porous parts in your teeth, or is it sealing your teeth? What's the process there that really
It's
happens?
actually putting a chemical into the teeth, and that chemical is light activated, and that in turn whitens the teeth.
Okay.
The teeth will remain white, however, again, it depends on the patient's habits.
Yeah, okay. So drink coffee through a straw.
Well, I drink coffee every day, and I think mine are pretty white.
You've got great teeth. How about those customized take-home systems that you see with the trays and the gels and things?
Excellent system. I love the customized take-home. I have a sample of one here. It's a
that's
customized,
like a clean little
yes, a
tray.
customized, yes. This is a model for demonstration of a patient's mouth.
Sure.
And it's a customized system that goes on the teeth. We put teach the patient how to put the material in there and monitor them, and this system works very, very well.
What are some things we need to know about this, though? I mean, for instance, can you buy the system and 3 years later it's still working if you haven't used all the...
Yes, if you have used all the whitening gel, you can actually purchase touch-up gels.
Okay.
But as long as you keep the trays from heat and they don't warp, you can constantly use the trays.
That's good, and they custom to your teeth, so that's
custom
perfect.
fit the teeth, yes.
All right, now what about the natural systems, like people who use the baking soda and the not bleach, the
peroxide.
Peroxide. Thank you. Let's make sure we don't injure anyone along the way here with Dr. Cola.
Those systems work very well also, but again, I would advocate working that with the dentist supervision.
Something else.
Again,
yeah.
if you have cavities, no system is going to work, because trying to whiten teeth when you have a caries situation is a system for failure.
Yeah.
Right.
So with the trays, how much do those cost?
The trays cost about half the light system, about $300, $350.
Okay, so you've got a $600 option that's an hour. You've got the $300 trays that would take a couple of weeks, I would assume.
2 to 4 weeks. You wear them about 30 minutes to a couple of hours a day. I like to refer to the two systems as this one is more the convenience store.
Sure.
This one is more the supermarket. The convenience store, you're in and out, but you'll pay more for it.
Right.
This one, you have to wait in line a bit, but you'll save money doing it, and both of them are effective.
Okay, and if you did the peroxide and the baking soda, anything we need to know about that?
You need to know that that system will work with limitations. It needs to be under dentist supervision. No cavities, no gum disease.
Yeah.
It will work, and it's very cost effective.
And don't brush too hard when you do it, because your gums
Use
will all
only
turn
a soft
white.
toothbrush, yes.
Yeah, tried that. Looked like a rabid dog. Dr. Melvin Pierson, thanks for being with us. We appreciate it.
Thanks for having me.